Good. Okay, we'll make a start. It's just gone after 1. So, good afternoon. I must, of course, begin by sadly acknowledging our first COVID-19 related death this week. And, of course, I extend my condolences, indeed all of our condolences, of course, to the individual's family and friends. We hoped against hope that that day would not come, but I guess we knew in reality that it would. And in fact, I'd like to imagine that we will be able to acknowledge at these press conferences every death in the same way as the first. But that too is probably an unrealistic expectation. And of course that makes this virus horribly real in our community. And I think it serves as a reminder to us all as to why we need to stay at home to reduce the loss of more lives. As ever, we don't have all the answers instantly to the very many questions many people have, but we do want you to keep asking them. Please do direct these to the helplines and the email addresses that you can find on the website, gov.gg/coronavirus, and of course, depending on the nature of the inquiry, is a different email addresses. We are also today inviting you to send your questions to COVID-19 inquiries@gov.gg and put in the subject heading "My Coronavirus Question." So that's COVID-19 inquiries@gov.gg, subject heading "My Coronavirus Question" in that subject heading. And what we're going to do is collate all of those questions, and then a number of the most frequently asked questions will be pitched to us at the next press conference on Friday. We'll see how that goes on that occasion, and then we can decide whether it's something that we can do again. Nikki's obviously going to update you on the cases, the numbers and the testing, and we'll also cover off some of the issues around the use of masks in the community and PPE as well. Heidi is going to talk about some of the issues the current restrictions bring for those living in abusive relationships, recognising that our challenges with this crisis go beyond simply managing the threat of COVID-19. And she's also going to talk about the fantastic work now being geared up in the voluntary and all the third sectors. Paul is also going to talk about some of the other issues, including around business support and a new community support tool. Last week I said we were reluctant for the island to go into lockdown until it was necessary for fear that the island would suffer cabin fever. Having had a kitten named after me and 3 chicks named after Nikki, Heidi and I, my worst fears have been realised somewhat sooner than I expected. But I actually do want to make a serious point. The three of us are, of course, immensely grateful for the messages of support that we have all received. And speaking personally, I can't speak for Heidi and for Nikki, but speaking personally, I'd be lying if I didn't say that it wasn't flattering. But it really isn't all about us, and it's incredibly important to make that point now. We are just doing our jobs, and we just happen to be in the spotlight as the public face and voice of an amazing team. Indeed, the whole community is incredible, and I'm going to return to that. We could not do our jobs without an army of people behind us. As my colleague Deputy Neil Linder says, if you lead and no one is following, well then really you're just going for a walk. So we want, between Heidi and I, to take the chance today to highlight some, and I'm afraid it can only be some, of those who enable us to do what we do. Dr. Brink is so clearly the expert in her fields of both virology and public health that she is quite literally, I think, the only person in Guernsey for whom it can be said that this is the job she signed up for. Calm, reassuring, professional, and clearly in total command of her brief. Heidi and I have known each other scarily for 30 years, and she and I have worked together on and off for 25, and again another highly professional, logical thinker and a problem solver. And I am extremely fortunate to have both of these individuals as my wingmen on this public stage. But I also want to thank other political colleagues. Politics everywhere, and in Guernsey too, is renowned for division and argument. But on this issue, we are all as one. And although I've name-checked a few over the recent days, I'm particularly grateful that I have been given the unequivocal support I need to lead, not only from Deputies Barry Breo and Mary Lowe, who sit with Heidi and I on the Civil Contingencies Authority, but actually from all of our colleagues. Right now, frankly, we would, of course, all swap the bailiwick's current predicament for the normalcy and rancour of yet another education debate. And I know that day will come perhaps all too soon. But in the meantime, we have to rapidly find consensus on how we can enable our system of government to lead the island through the next few months and the bailiwick's recovery, with the quick-fire decisions that will be needed, whilst also maintaining the democratic accountability and oversight of the decision makers. I also want to thank the Chief Executive and his senior leadership team. In 30 years of working, I've been privileged to work with some very intelligent and highly professional people. But what marks this group of individuals out is their complete unflappability. So much so that I sometimes think that I'm actually living through a drill rather than actually the real thing, because as new information and new challenges are injected into the picture, no one seems to lose their cool. They simply and quietly just adapt, and actually normally do so with good humour too. So Guernsey is immensely lucky to have this group leading the organisation of the bailiwick's response, and we can all be very proud of that, as well as very reassured. But finally, from me today, if my role means that I am the focal point of leadership in the island right now, that is only really a testament to the whole community's spirit. Our interconnectedness and reliance upon each other is so starkly exposed by this crisis. The nurse can't go on shift to help the sick patient without the teacher taking care of his kids. And the doctor can't treat her patient in the new ICU without the plumber who helped build it in the last 2 weeks, and so on and so on and so on. The world in recent years has seemed so endlessly divided and polarised, with 24-hour news feeds projecting images that suggest that greed, violence and conflict are the key features of humanity, but that's wrong. The defining characteristic throughout human civilization is our ability to cooperate and work together. And Guernsey Together is not just a slogan or a hashtag. It is what our community in the bailiwick is doing right now and will do to get us through this crisis and out the other side. So that's enough from me, but I'll hand over to Heidi, who will flesh that out a bit more. Heidi.
Thanks. And just following up from what Gavin said, I'd like to thank everyone who sent us such really lovely, kind messages of support over recent days. They really are appreciated, and it's been an intense and surreal few weeks for us. And those messages, certainly personally, have definitely helped me keep going. But we really are only the front of house. There are so many others who are doing so much more, working very long hours behind the scenes and on the front line. Now, I know a lot of focus has been on the PEH, and it's totally understandable, as we have told you all of the amazing work being done there to ensure we're prepared for the days and weeks ahead. But it's important that we understand that frontline workers are doing their stuff right across the community. That includes our ambulance service, child protection, adult safeguarding, rapid response and twilight teams, and community nurses, to name just a few. There are many more. We think of people becoming ill and having to go into the PEH, but the vast majority of people don't need that level of care. We don't want people to be admitted to hospital either, unless they absolutely have to be for their own good. That is why the role of community nurses and others who provide support at home is so important, and will become increasingly so over the coming days. Their role is as crucial as those in a more clinical setting, and I'd like to thank them all for the work they're doing on the front line. You are not forgotten, and you will not be forgotten. And leading on from that, I think I should mention the amazing support being provided by volunteers across the community. There's no way I can cover all that is being done right now, and we'll say more over the coming days and weeks. But I have been so bowled over about how the community has come together to provide support both to those working on the front line, but also to our more vulnerable islanders. I just can't get over how wonderful people have been. We've seen businesses and groups of individuals get together to provide some really useful stuff, like soaps for PPE packs, slider slippers when needing to shower at work, food vouchers, fridges, microwaves and kettles for those who can't return to base due to infection control. The community has created its own groups, such as the Guernsey Isolation Support Group on Facebook. The Association of Guernsey Charities, Guernsey Community Foundation and St John has set up a coordinating group under the banner of Volunteer Guernsey that will maintain a register of volunteers who can be deployed in response to requests for help from both individuals and charities. The formation of this group was in recognition that volunteers need to be suitably trained, DBS checked, vetted and matched to their respective needs. And this will ensure that they and those in need of support are appropriately protected. This will minimise the number of journeys and home visits that volunteers carry out and reduce the risk of infection spread. St John have established a route to fast-track the vetting and training of volunteers so that a pool of helpers is in place to ensure resilience. Volunteer Guernsey is working with many other community groups offering similar support, such as Health Connections, Guernsey Isolation Support Group I just mentioned, the Guernsey Voluntary Service and Carers Guernsey. An illustration of the community's response is Volunteer Guernsey has had 100 volunteers come forward, as well as multiple offers from businesses in the last 72 hours. With people volunteering to do shopping, pick up medicines and generally provide support where it is needed, for no recognition whatsoever. I hope we can say more in future briefings about all that is going on and also how anyone who would like to do their bit can help. But for now, I'd just like to say thank you to each and every one of you for what you are doing. It is making a real difference to people's lives. Thank you. But I'd just like to focus on two areas where we have great third sector support. The first is in relation to mental health. Guernsey Mind have moved their community support groups online, including group meetings for Men Club, Hope Singers, Book Club and Women Matters, and are delivering one-to-one telephone support. The second is in relation to domestic abuse. We know from evidence across the world that the risk of abuse is heightened during periods of lockdown. But my message to any of you who are experiencing abuse, or those of you who know people who are experiencing abuse, is that help is out there. If you're in immediate danger, you must call 999. We're not just talking physical abuse here, but emotional, financial, sexual or psychological abuse. None of this will be tolerated and the police are there to help. There's also an app called Holly, that's HOLLIE, that can help. It turns your smartphone into a safety device which can be activated by shaking it, sending your location to designated contacts. And I've tried it out and I can say it's not perhaps the easiest to set up, but I really do think it does the business. We also have partners at Safer who can help. Call them on 721 999. There's also a lot of useful information on their website, safer.gg. Finally, don't worry about escaping the house, as it will be considered an essential journey, and more information will be provided on all I have just said later today. And finally, from me, and on the subject of volunteering, and I've probably taken this away from Paul here, but I thought it linked in very well on the matter of volunteering, because there's something we can all do to help our public health colleagues in the wider community. And it's really easy. Some of those hard-working guys behind the scenes I mentioned at the start have created a little app that you can all use that will really help Nikki's team. It's called the Community Monitoring Tool, and it's only called that because we really haven't had time to come up with something a bit more snazzy. But anyway, you can find it on gov.gg/coronavirus. Now, we've spoken a lot over the few weeks about the importance of evidence. Evidence is what is determining the decisions we make. Well, now is your opportunity to really help us provide more evidence that will be so valuable over the coming days and weeks. What we're asking is that you fill in a really simple form on gov.gg/coronavirus that will help enable us to get a really good picture of what is happening in the community. Filling that form in will mean you'll be asked how you're feeling each day. whether you're social distancing, self-isolating or shielding, what information you need, and whether you're still able to work. So something really quick and simple that will help us in making the right decisions in the future. It's another example of Guernsey Together. And on that, I'll move to Nikki.
Nikki.
Thank you. So the last few days have been probably the most difficult for all of us, with the death of our first patient, and our condolences go to the family. We really feel for them. I think it's also been difficult because of the outbreak that we've been dealing with in a nursing and residential home. And we've been working round the clock to try and characterise exactly what is happening there. And we're doing contact tracing, we're looking into all of that. From our perspective, on a positive note, we were encouraged when the Guernsey Together spirit came out again, and literally everyone came in to help, and that was really, really encouraging, not only within public health services, because we were overwhelmed with a huge amount of extra work, but also most importantly within the care home. And I know that Dr. Raby will talk more about that. So a very, very difficult few days for the public health team, but also for the whole of Guernsey. I think the highlight for us last week was the on-island testing coming on board, and what we've started doing this week is we've started testing people presenting with respiratory tract illnesses to the long-free surgery. This is going to give us a much better handle on what's happening within our community, and I hope when I next talk to you we'll have a further update on that. So that's been really encouraging. The only concern we have about that is the ongoing supply of reagents. There's a global shortage of these reagents, and we're keeping trying to acquire as much as we can. And I have to say we've had huge support from the States of Guernsey to provide us with as much financial support to get as much testing as we can. So that's been greatly appreciated, because that will then enable us to characterise exactly what's going on our islands. So really important for us. But as we secure our direct viral testing, which I'm sure you recall is by the PCR methodology, that's actually looking for the virus itself, we're turning our attention forward now to antibody testing. So what we've been doing this week is also appraising different antibody tests and looking at how we can test both specific groups, for example, health and care workers, but also the wider population. So we're looking at different testing methodologies, and we're hoping to start rolling that out. We don't have an exact time for that, but we're looking at various suppliers for the antibody tests. We're very clear that we want to know the performance of the assays that we're using. We want to know their sensitivity, so how good are they at picking up a positive result, but we also want to know their specificity. If we get a positive result, are we sure that it's a genuine positive and not a false positive? So we're looking at all of those test parameters as we evaluate these kits. So the final thing I wanted to say was the issue about staying at home. There's been a lot of information about wearing masks in the community and so on, and I think the thing that I would like to say is the most important thing we can do is stay at home. And if you have symptoms and you're in lockdown, don't come out for those 2 hours. If you have respiratory tract symptoms, put yourself into self-isolation in your home. It's really, really important, because unless we as symptomatic people actually keep themselves out of the community all the time, is we're going to get ongoing transmission of the virus. So really the most important thing, if you want to prevent transmission, is to stay in lockdown, stay at home, adhere to the rules of lockdown, but if you're symptomatic, put an extra level of caution on and go into self-isolation. Really important, because that'll then prevent the onward transmission of the virus. And from us, that's the most important thing as we try to, and I say it again to you, flatten the curve. So thank you.
Thank you. Peter.
Thank you. From the hospital point of view, I'm really pleased to say that we don't have a huge amount to update you on, and I hope it stays like that. We've got one patient in the hospital with confirmed COVID disease, and that's all we've got at the moment. Everyone else has gone home, apart from the one who so sadly died that we've spoken about, and I'd like to just express as well my commiserations to the family and friends of that person. We finished phase 1 of preparing the hospital, really, although there's always more to do in terms of separating out the clean and COVID-affected areas of the hospital in the emergency department, getting the new intensive care ready, getting the medical wards ready to receive COVID patients, and that's all gone smoothly. We're starting to work on phase 2, which is which parts of the hospital and what else on the island we might need to get people ready, for people who, A, if we're overwhelmed, and B, people who are just ready to go somewhere and don't need to be in hospital but need some low level of support. So we're working on that, and that's just going ahead. Our medical cell continues to review. You can imagine there's huge amounts of publications happening on a daily basis on this subject, and our medical cell is keeping abreast of that, revising regularly the recommendations for how we're going to manage COVID in the community, in the emergency department, on the wards and in the critical care. And that document's a live document, gets updated regularly and is being shared with our colleagues in Sark and Alderney. I need to mention the community, the care home situation, because that's really been the focus of the action over the last few days. The affected home has been facing a really difficult position with numbers affected and numbers of staff affected. And we're an island, we're all in this together. We are doing what we can to support them in terms of community nurses going into the home to help out. And we will continue to do that. We are aware that people are working in really quite difficult conditions in some circumstances, and we are helping them. We've had offers of support from the St. John's Ambulance Service as well, and so lots of support going in there. I'd like to talk about PPE supplies because we've been really tight. I'm really pleased to announce that just before I came here, we've had a delivery from the NHS supply chain, which we've been eagerly awaiting. It doesn't mean that we've got all the kit we want. We're going to control it really carefully. But we are able to provide supplies to care homes and other locations as we get requests for help and as we can. So we're in a better position this afternoon than we were this morning on that front. So that's really good news. Finally, from me, I think, blood donation. We still have enough blood supplies, but what we're finding is that when the department's phoning people to come in and ask if they're willing to donate blood, quite a lot of people are having second thoughts about that, and they're having to make a lot of phone calls to get volunteers at the moment. We'd like to assure you it's absolutely safe to come in and donate blood. If you get that call, they will screen you whether it's an appropriate time for you to give blood, and if they ask you to give blood, please do. It's perfectly safe. It helps everybody, and we really respect those volunteers who do that, but please don't give up on it now. That's all from me. Thank you.
Before I hand over to Paul, just to pick up on a couple of points there. Peter, first of all, of course, travelling to give blood would be an essential journey.
Yes. We don't want you in the hospital with symptoms, and they will talk to you before you come in, so don't come anywhere near us with symptoms to give blood, please. But if you have to come in, please come in as an essential journey because it's helping others. Thank you.
And secondly, in relation to PPE, again, I think there's probably some confusion that actually the full PPE is sort of required for every occasion, and that isn't the case, is it? Because I think managing expectations about when it should and shouldn't be used is something which is misunderstood.
This is really important, actually, and we're sticking absolutely to NHS best guidance on this. If the patient has respiratory symptoms, for normal contact with them, the recommendations are as they are, and that's basically we like you to be bare below the elbows. We want you to wash your hands. We want you to put on a plastic apron, a face mask either for yourself or for the patient if we're in very short supply, and we'll advise you on that, and gloves if you're doing anything with the patient. If you're doing anything that generates aerosols, and healthcare workers who generate aerosols know what I'm talking about, it's quite a different level of protection, and you need to wear the full kit for that. But they know people know who need to do that. So yeah, stick to the guidance is what we're saying. Don't waste our precious personal protective equipment. Stick to the guidance, and if you've got any questions, ask. We can help you with that.
And sorry, Nikki, just one question for you in relation to masks. You were very clear that anybody who has respiratory symptoms should self-isolate and should not be coming out.
Yes, they shouldn't come out.
But could you just speak for a moment about the use of masks by asymptomatic people in the community, so people who don't have symptoms? Is there any merit in it? Would you mind just addressing that?
So there's been quite a lot on the use of cloth masks, reusable masks, putting a scarf across your face and so on in the community. Now, there's little evidence to suggest that this is going to prevent COVID, the transmission of the virus that causes COVID. So we just don't have the data to support that. However, some people may feel reassured by it when they go out. What I would say is wearing a mask when you're symptomatic and going out is an absolute no. So it is not, well, I've got a mask on, I'm a bit symptomatic, so I'm okay to go out. That's absolutely not the case. So if someone feels reassured by putting on a material mask, a cloth mask, before they go out, as long as there's certain things that are adhered to. For example, if you're going to do that, you need to change the mask every 2 hours. You need to wash the mask in a washing machine using a detergent, tumble dry it and iron it. If you use these devices or use a mask inappropriately, you could actually increase your risk of infection. So if you touch the outside of your mask, don't wash your hands, then touch your face, you're actually increasing your risk of infection. So I think you've got to be very, very clear about it. So the advice from us is clear, is if you're symptomatic, stay out of the community. Don't say, well, it's fine, I've got a mask on, I can go out. It's absolutely not fine. You're putting other people at risk, and that's really, really important. If it comforts you to put a mask on, I don't have a particular problem about that. If you ask me, is there evidence to support you doing that? I'd say there just isn't the evidence, but if it makes someone feel better, as long as it's used appropriately, it might provide a little extra protection, but your major protection is going to be your social distancing, number 1, your washing your hands, number 2, and self-isolating if you have any respiratory symptoms at all. Those are going to be the really important things that prevent transmission.
Great, thank you very much. So, Paul.
Yes, good morning. I'd like to start off. I've been asked to pass on a message. In my role, having responsibility for the oversight of public services, many of our leaders have expressed a desire for me to pass on a message of thanks. Our services obviously spread a whole mandate of from waste management through to the ports, emergency services, our teachers still looking after essential workers, care in the community, social workers and administrative staff that are dealing with benefits and claims. The majority of our services report back that the community have acted with the utmost responsibility to the call to stay at home and stay safe and follow the advice given by our experts, and our services leaders just wanted to pass on their thanks to you all. They say the response has been outstanding. We know, however, for the some, this call will have brought with it its own pressures. Our services are in the process of responding to those pressures and understanding what you need through the high volumes of calls and emails we are receiving literally hourly. Measures are in place to support business and to support those in need of financial assistance. Call volumes are very high and we are putting in increasing numbers of staff to deal with this. We are also mindful that we all need to support those who will be finding this an anxious time in the community. As Heidi mentioned, to help us understand what is happening out in the community, we have launched an online community monitoring system. This will tell us, amongst other things, the proportion of the public self-isolating, those who are still able to work, where we can improve the information and support we are giving you. But in using that, I just wanted to give you an assurance. The app has been built using existing technology and a trusted IT partner to ensure your personal information provided is appropriately safeguarded, but will provide us with an essential source of information very quickly. And we would really encourage you, because this will really help support Nikki, the team, and all the services that are trying to assist the community as we deal with this ongoing situation. We have not forgotten those who are not easily reached through technology, and we will be using all means available to provide everyone with the information and support they need. Hopefully those of you over the age of 65 have received specific information by post to supplement the information which is also available online. This is only the first week since we moved to stricter measures, and just like for every business and every household, this was a sudden move for us in the public services. We have responded by concentrating our efforts first on essential service areas of great importance and value to the community right now. The Hardship Fund has responded to over 11,000 inquiries, and Business Support has had more than 2,000 emails requesting more information, and we've sent on and forwarded over 2,500 forms have been sent out today for completion. We are responding to your immediate needs and will continue to do so, but are also mindful what will be needed further down the line as we move through this and on a large scale of how we are able to respond. We are still learning, and our response to this situation is developing daily. So we intend to provide more information, and indeed we will be fully updating and refreshing the website towards the end of this week and over the weekend. Thank you for your support.
Thank you very much. Just a quick question, Paul, on the community monitoring tool, just to be, for the avoidance of doubt, that's any individual can complete that. They don't have to have symptoms. If they just want to participate and help build the data for the public health team, then they should fill it.
Absolutely, as Heidi said, this is an ask. This is an ask from us, from you, for everyone to go and use that app and provide us with baseline information about how you are, your situation, what you're not getting enough of in terms of information, and we can start building around that. Even today, and we've only just launched it, we've got over 700 have put details on already, so we really would encourage you to use that application. It will help us, help Nick and our team, and also our service providers.
Great, thank you very much. Okay, so we'll open up to questions. Who wants to begin? Great, okay, nice and loud, please, for the... Thank you.
I wanted to ask about PPE. You said that we get our PPE from the NHS. There's a global shortage of PPE. Do we have a backup plan?
Yeah, we're doing lots with PPE actually. So we're part of the NHS supply chain, and we're really pleased that delivery has arrived today. But we're doing other things as well. You know, there's a global shortage of PPE, and we've been trying to source PPE. We've got the procurement team who have suddenly become everybody's best friends, trying to get PPE from all over the world, and following up leads from the most odd-looking places. But we've got a lot of orders in. Some of them will come to fruition, and some of them won't. But we're chasing every lead. And lastly, from me, people on the island have been incredibly helpful with this, and we've seen people actually printing 3D visors for us, eye protection stuff locally. Absolutely fantastic community response to that. Dare I mention cloth masks? We can make cloth masks on island, so we're getting help with that. We're pursuing every avenue.
It's interesting, knowing so many people on the island who do things that we didn't know existed up to now, and they've got contacts who have been helping us and been feeding that through, and some of those contacts have really come to fruition. So thank you, everybody. If you think you might, there's a possibility you might be able to help, but you're not sure, just please contact us.
Next question. Yep.
Is it possible to get an update on the numbers and the difference between now and Monday?
So we've now got 620 negative and 91 positive, with 38 test results awaiting results.
So from Monday, that's a 31 patient increase.
Yes, round about that.
Do we have any indication why that might be?
That's largely to do with us proactively looking for cases in the nursing and residential homes. So we haven't just gone and looked at symptomatic cases. We've actually been doing widespread screening within that setting. And I think that's really important because it forms part of our proactive approach. And we've always said we wanted to have a very proactive approach. And I think that's so important under these circumstances.
From the care home, you told us there was 3 patients that tested positive. Has there been any more since that announcement?
Yeah, so we've got 16 residents testing positive now.
And what's the diagnosis moving forward for them? What will be the course of action for them?
So most of them are being cared for. In fact, all of them are being cared for in the residential home. So Dr. Raby's team and the community team have put more resources into the care home, and Dr. Raby can talk more about that to help manage within the residential home.
We've had a great response from primary care with this. So one of our GPs went into the home yesterday and did assessments on everybody in the home to just get everybody's care plans up to date. He's got input from geriatricians back at the hospital. So we're seeing a great response from our primary care team with this. And there's a community homes cell being set up that was meeting as we started this press conference, actually, virtually meeting, to talk through the issues about the care homes every day, and they're in constant communication.
And Nikki, whilst the increase in positive cases, you clearly prefer not to see an increase in positive cases, but actually the fact that they are clearly clustered and also coming out as a result of the contact tracing is positive, isn't it, for you?
It's absolutely, and we did more than contact tracing. We decided to screen everyone under those circumstances. So it was a very proactive approach. And I think what we must all be aware of is that the clinical presentation, particularly in elderly people, possibly people with dementia, is entirely atypical. So they won't present necessarily with a classic fever or cough or shortness of breath. Sometimes it'll be they're just not quite themselves. So they often are far more subtle changes. And so we wanted to make sure that we identified all the cases so that we could provide the appropriate help and support.
Okay, next question. Yep, Aaron.
Can you please say how many staff were affected?
Yes, 11 staff are positive.
Okay.
Would you consider doing widespread testing in all the care homes in Guernsey?
I would love to do really widespread testing, but I've got to be cognizant of the resources we have and try and focus those on where we need them most. We could do far more testing on island, but there is a worldwide shortage, as I said earlier, of the reagents. So we need to make sure that we focus the testing on where it's going to be most beneficial. And as such, we've developed a testing strategy. So that enables us on an evidence base to look at where we should target our testing. But it also allows us flexibility. So I can sit and I've discussed this with Dr. Raby as to which groups would benefit most from testing, and we'll literally change it by the day if the clinical information indicates that we need to change. It is a very fast-moving situation, but yes, we could test up to a couple of hundred tests a day if we needed to, and if we had all of the reagents that we needed.
Just on the question of testing, clearly having the on-island facility, you've described it as being a game changer.
Yeah.
Again, we've touched on this before, but probably the next game changer would be the antibodies, the antibody testing as and when that is at a level of efficacy that you're happy with. Is that right?
Yeah, absolutely. So the antibody test, the one we're looking at, we told it's 2 to 3 weeks off, but that's not an absolute promise because these things change from time to time. But we'd be looking, that's 2 to 3 weeks off actually being available, and then you'd have to procure the product. So from our point of view is actually looking at how many of our population have been infected and looking at a mechanism to know who's been infected, who hasn't. It'll give us an idea of how widespread the virus is around the community, but it'll also give us an idea of who's immune. So enable us to target our working more accurately. So I think that's really important. So that's something we really want to focus on for the next few days and develop our strategy. So we've outlined a antibody testing strategy, and we want to refine that and see where we go from there.
It's another example of planning to be one step
Absolutely,
ahead.
Yeah.
Okay, next question. So we'll go here on the right.
I was just going to ask about phase 2 of the hospital plan. You mentioned that you were looking at other locations. So are they potentially hotels or other maybe empty buildings that aren't being used right now?
We're looking at lots of things, but we haven't settled on anywhere yet. We just have to bear in mind that even the best prepared health economies can be overwhelmed in these circumstances. And if there's anything that we can be doing to set up field hospitals if we need them, that sort of thing, we'll get preparation done as early as we can and be ready to move if and when. So absolutely no locations ruled out, no locations ruled in. There's issues with this, oxygen supply, staffing. There's lots of issues, and this is not a straightforward thing, but we need to do the preparation now.
Paul.
Yeah, if I can just add to that, obviously we can't expect Dr. Raby or Dr. Brink to do all these work streams, although that they advise us. So we've got a number of groups, cells of people working on specific projects, and that's a case in mind where we're looking at the practicalities, where would be the best location, what equipment would we need, how would it be staffed, how would we get a reasonable oxygen supply into a facility such that would it be clean enough. So all these work streams are set daily and have specific objectives to meet in order to get the information and shape it up that would meet the experts' needs. So that's continuously going on a daily basis.
Okay. Aaron.
As the number of positive tests increases, do you have enough staff and resources for all the contact tracing that's needed?
We've expanded our contact tracing team again. So what has been fantastic is how we're managing to train up increasing numbers of those. So in fact, the environmental health team are located with us. The Health Improvement Commission has sent people to help us. And in fact, some of the deputies are also part of our contact tracing team as well. So we have trained up a significant number of staff now. And at a time, you might decide, well, we don't want to do further contact tracing, but we're not there. So we need to contact trace. So we're still on the identify the case, quarantine them, and contact trace and flatten the curve. And that'll be the strategy for the foreseeable future. But yes, we're working 7-day weeks up till sort of 9, 10, 11 o'clock every evening. So the team are tired, and what I'm now doing is enforcing rest days so that people are actually resting for a day. And I think that's really important because we're in it for the long haul, and we need to make sure that our team remains rested and resilient.
And just on that, just to clarify that despite the increase in numbers, we remain in the delay phase of the contain phase.
I think we are in between contain and delay,
Yes.
so we're moving into delay because we've got more community transmission.
Yeah.
So I think that's really important. But we're sort of in between the two at the moment,
Yeah.
so we're focusing on that.
It's important to appreciate that we put in measures that would normally, and certainly the UK and elsewhere, have been doing at the delay stage. So the lockdown that we've imposed, that would normally be done at a delay stage, but we've done it through containment because of the cautious approach that clearly we've been mentioning in the past.
We've always had a more cautious approach. So in our contact tracing, we've gone back to pre-symptomatics. We've locked down early. We've rolled out community testing earlier. So we've always had a more cautious approach.
Okay.
Now we've got on-island testing. We saw this morning there was a spike in the number of people awaiting results. That's now dropped, judging by the figures. How long does it actually take to do a test? And how should people be interpreting the results? Should we be surprised there's a lot more waiting?
A lot more waiting. That relates to our low threshold of testing. So we're not sticking to the classic triad of fever or cough or shortness of breath because we think there is a broader spectrum of respiratory illness. So it reflects our change in strategy that we're having a much lower threshold for referring people for testing. We also, any contacts of known cases, even if they have a slightest symptom, we refer them for testing. So that again probably represents our more conservative approach. We just want to get more numbers through so that we can get a good handle of what's going on.
And on average, how long does that take for each test?
For us to do the test in the laboratory? Half a day, but there's the sample preparation, so 24 hours by the time you've prepared the sample, you've run the assay, you've collated, quality assured the assay, you've entered all the results, so about a 24-hour period.
Okay, at the back.
Can I ask about testing again? You mentioned that you have a shortage of some of the chemicals at the moment, but how many tests are you able to do per day at the moment, and how many tests would you be able to do per day with this on-island equipment when you have the chemicals?
So How many we do a day at the moment depends on what the clinical need is. So we've made an allowance of doing 40 tests from the long-free surgery, another 10 or so tests from the hospital. But for example, over there, yesterday we did close on 100 tests. So it varies on what the clinical need is. So we can do, if we had all the reagents, we could probably do up to a couple of 100 tests a day. But at the moment, we're probably doing in the region on an average of about 60, 70 tests a day, with some days being bigger days because we need it clinically.
Okay, next. Yep.
And these reagents, do we have enough in Guernsey? And looking ahead to the future, are we getting more?
Yeah, so we've got large orders in for these reagents. So again, we forward planned for that. We anticipated that there would be a global shortage of these reagents, and so we get a certain amount delivered every week. So what we try and do is look at what our delivery is and then try and test in the most appropriate way. So it's always forward planning, looking what we've got, where our greatest need is on the island. So we're trying to make the testing responsive for our island situation.
Okay. Yes.
Going back to the antibody tests, we've talked about home testing before. That's not the same thing? Are you able to clarify the differences between them?
So there is a home antibody test. That is not the way I'd like to go, because what I'd like to do is have validated antibody tests. So I'd like it validated. I'd also like to be able to link it to what we call demographic information, so we know who's positive, what the age group of positivity are, so it gives us some intelligence about what's happening on our island. Also, if we look at releasing people on the basis of an antibody test, it needs to be a validated test that we're happy with. So although the home test, the sort of cassette test, a bit like a pregnancy test and things like that with a finger prick, are being suggested, is if we use that system, or indeed we used another system, which would be a larger automated system, we'd look at actually doing it clinically and gathering that data and linking it into our pathology systems. So it then gives us great information of what's going on.
Okay. Yes.
What happens if you get sick?
Sorry, who's that directed to whom?
Any of the key players?
Well, I mean, we're obviously have all got support in terms of backup, in terms of the people who would step into our shoes, as it were. And Paul also is we're seeking to make sure that those individuals don't have contact, so that we try and minimise the risk of losing our support. But Paul, you might want to just talk about that a little more.
Just add to that we talked about those separate groups that are working. So we have a particular tactical group that are working on a resourcing plan for right across all the public services, but that includes its leaders. So my immediate team is making sure people that are sort of potentially single points of failure or specific in terms of their knowledge around finance, around people, around technology support, actually that they don't come together with their opposites or seconds in command, for want of a better word of describing it. So therefore we're building resilience at how we operate. And of course we are using technology between us. We meet to give these media briefs, but most of the time we're meeting completely separate using a team coordinated conference site, and that's how we're conducting our business.
I think we have to remember that for most people the symptoms will be mild, and we've seen in the UK Prime Minister is able to carry out his business that he needs to do, even though he's self-isolating, so we will need to remember that.
Okay, next question. Yes.
Dr. Brink, are you looking for any sort of local patterns in things like age and gender, and have you noticed any yet?
So I haven't re-looked at age and gender over the last 24 hours. I just haven't had a chance to do it. But when I looked at it about 24 hours ago, we had a roughly equal gender distribution, and our age was about 52. Our median age was about 52 years, and that was about 4 years older. So the UK was sitting at about 48. So we don't think we're vastly different, and we think it's consistent with the ageing demographic. But I haven't done an analysis over the last 24 hours, and I think with the recent cases that might well change. So apologies, that's a bit out of date. I will get onto it. I just haven't had a chance over the last 24 hours.
Okay, any more? Yes.
I was going to ask a question about, last week we heard that there was someone with symptoms who was carrying on their day-to-day life and had come in contact with a large number of people. Are you able to give us an update on that? And has the contact tracing been done with the amount of people that that person came in contact with?
So all our contact tracing is ongoing, and I don't really want to comment on individual cases, but we have identified from the contact tracing across the spectrum, we've identified a number of secondary cases, and that's what makes the contact tracing worthwhile. So with the contact tracing, not only do we get contacts out of the community, but we then identify potential infections. And then with the contacts that we get out of the community, we can say, if you become remotely symptomatic, we'll then screen you. And that goes back to your question about why so many people are getting tested. It's because we're identifying these people with very few symptoms, but we're opting to test them because we want to get an idea of what's going on.
With that person going about their day-to-day life for a couple of days, does that put more at risk? And what sector was this person working in?
So I can't comment on what sector the person's working in, but anyone who is symptomatic and goes on with their day-to-day life puts other people at risk of infection. And that's why when we speak about all the measures that we take is if you are symptomatic, you need to self-isolate at home because that puts other people at risk of onward transmission. And it's just, I can't say it enough, is stay at home, and if you're sick, stay at home and self-isolate.
If I could comment on
Please.
that, just from the hospital point of view, our hospitals run with a large number of small teams, and getting positives in a small team that have been in close contact can potentially put us at risk. So we're emphasising over and over again to healthcare workers, don't mix with your colleagues if you don't have to mix with your colleagues. Keep that social distancing. Don't come into the place if you've got any symptoms at all. And we're emphasising that very strongly because we're vulnerable if people do that.
Yeah.
Okay, any more? Yes.
You said that we've got 91 confirmed positive cases, but do you do modelling for an estimate maybe of what percentage of the population locally could be infected?
So we're doing that as we speak. So we're looking at various modelling, and we can model on a 10% attack rate, a 50% attack rate. So we've got various modelling assumptions, and those will give us some prediction of the cases that we're likely to see. We haven't modelled on this specific data yet because we've been dealing with acute situations, but we will be looking, and this is one thing that the data intelligence team are looking at, is looking at modelling as to what we've got and where we think we are within our curve.
Okay. Yep.
How beneficial do you think it would be for people to keep a diary of their movements? So, for instance, they did come in contact with the disease, you'd already have that data.
If everyone could keep an accurate information of all their movements, I'm not sure how practical that is, but it's actually, when we identify a case, the first thing we do is a case interview, and that takes about an hour, and we map all the activities that case has done. Then we go to their contacts, and we check back with their contacts on the activity of the case, and we validate all the data. And on the basis of that, we then we then work out who are significant contacts and who we need to focus on. So there are some people, for example, we'll put into what we call passive surveillance. So they are people that, for example, a doctor that saw a patient with full PPE on will ask them to have a low threshold to report if they've got any symptoms because they were working in full PPE. There are other people that we'll put onto active surveillance, which will say, take out of the community, and if you have any symptoms, we'll then investigate them.
Of course, unless they're essential workers, they shouldn't really have any diary that they need to fill in now.
Yes.
I think that's really
true.
important to remember.
Yes, clearly the vast majority of people should not be having contact with anybody outside their household. It's as simple as that. Yep.
Are you able to tell us anything about people who might drive to go to leisure activities? We've seen in the UK press some police were taking rather stern measures over there, monitoring on drones and things like that. But what is the advice over here in terms of going for a walk? Should we be driving to go for a walk?
Well, I think the advice that we've given before at these press conferences is really to keep it to a minimum. Yeah. So if you want to drive to take a walk, go somewhere that is close. You don't have to go to the other end of the island to do it. And that's really, again, it comes back to a phrase we've used many times in the last few weeks. There has to be an exercise of judgment and common sense.
What I said on Monday now, we don't want people just driving around the island and then going home again. That's not the purpose of those 2 hours. It's to try and get people to get some exercise after being confined in their homes all day. But I think there is a slight difference between here and the UK. So I think in the UK, the idea is to keep people within the close proximity of their home. They didn't want the virus spreading from urban areas into rural areas. So I think that's probably more the reason for that, the way they're going about it there. I don't know if Nikki has any more to say on that.
No, I mean, I think it's just minimising any journey that you have to take. Every time you're on the road, you drive, you don't have to put petrol in your car, so you go to the petrol station, you've got the chance, heaven forbid, of having an accident. So it's just minimising any activity. So we're asking people is stay healthy, use your 2 hours or up to 2 hours, but look at what you can do close to your home. So minimising any contact with anyone.
Okay. Any more? Yep.
Maybe a question for Mr. Whitfield. You said that you'd had, I think, 11,000 inquiries to the hardship fund.
Yeah,
is that a fund for businesses? And can you tell us what sort of thing businesses are saying?
I think that covers a whole plethora of requests, given the different shapes and sizes of businesses, from very small businesses, self-employed businesses, to some of the larger scale concerns that have difficulties. So there's a whole raft of issues that have been presented, and we're sort of spinning up our response to that against the sort of request. The Economic Development Cell, which comes from the Economic Development Committee office area, have extended the size of the team working on that so that they can add to the advice that's given as we go on.
Okay, one more question then. Yeah.
A week ago you said that we were in lockdown for 2 weeks. We're slightly over that now. Can you give us an update on your thoughts on that?
Well, we're not slightly over 2 weeks. We're in
slightly over a week.
Slightly over a week. Yeah, I mean, I'm afraid I can't give a different answer to the one that we had on Monday to the same question, which is we will keep it under review, but it's going to be very much informed by the public health experience and the advice that comes based on the evidence. So it's still too early to say, I'm afraid. We did say, of course, that it was an initial period of 2 weeks, but the island should prepare for it to be longer, should prepare for it to think of it as a 28-day period. That advice hasn't changed. You know, in a sense, nothing's changed from the original notification. But we will obviously keep people informed as our own thinking changes. Then we will absolutely keep the public informed. Okay. Well, I think thank you very much. It's really just a final message then for those that are watching or listening live, that if they have got any questions, to email them to COVID-19 inquiries@gov.gg with the subject heading My Coronavirus Question. We will collate those, and the most frequently asked question, we will attempt to deal with some of those. We probably won't be able to deal with them all, but we'll try and deal with some of those when we meet again on Friday. Thank you very much indeed. Thank you.